We don't want you to be anxious. We want you to be ready.
Ready not only for the coronavirus, but for the flu as well.
As we deal with concerns about novel coronavirus worldwide, doctors and health officials here in Ohio say we're more likely to catch the flu.
But they do tell News 5's Olivia Fecto it's still not too late to get that flu shot.
Yeah, Robin, the health officials say it would have been better for people to get the flu shot earlier in the season, but it is still available, and it's one of the best ways to protect people from the flu.
We're front and center thinking about flu.
That's no surprise in Cuyahoga County, where 2 more women were added to a list of flu-related deaths in a report out today. 16 people have now died from flu-related causes this season. Among them, Dr. David Taylor, a cardiologist at the Cleveland Clinic. The clinic says he died February 5th from a complication of influenza. In a statement, the clinic wrote in part, quote, "He was an outstanding leader and gifted teacher, highly respected by his colleagues and committed to his patients. He saved the lives of countless patients and will leave a lasting impact on them, as well as the many colleagues, trainees, and friends he has touched over the years."
Over 3,500 people have sought care in emergency rooms, and we know that almost 1,500 people have been hospitalized.
As we go through one of the 3 most severe flu seasons of the past decade, the Cuyahoga County Board of Health is urging people to take steps to stay healthy, from getting a flu shot to staying home if you're sick.
The idea of cough etiquette, washing your hands, cleaning surfaces, and frequently touched areas in the home and at work.
If you're having problems with high fevers and cough and runny nose and trouble breathing, it's much more likely to be influenza than it is to be this new coronavirus.
Dr. Frank ESPER of Cleveland Clinic Children says this year, with a flu season that started early and shows no sign of stopping anytime soon, people need to protect themselves.
It's a numbers game. The longer it goes, the more people can get sick, and the more people who get sick, the more people are likely to get very sick.
That's especially important for the very young and for people older than 55 or so, as well as those with respiratory issues or underlying medical problems.
It's nothing to fool with flu, and it's important to know that it isn't just about you getting your vaccination. It's about your family members, your coworkers, your friends, and then you become part of this public health solution, not potentially part of the problem if you're sick.
And Ohio Governor Mike DeWine says the state is taking steps to mitigate the risks of both coronavirus and the flu. Olivia Fecto, News 5.